The Trump administration is poised to make a significant announcement today, suggesting a potential connection between the use of acetaminophen, commonly known as Tylenol, and an increased risk of autism when taken during pregnancy. This claim comes despite the absence of definitive scientific evidence establishing a direct causal relationship between the two. During a press conference scheduled for this afternoon, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. is expected to present these findings. President Trump hinted at the importance of this announcement, stating, "We're going to reveal one of the most groundbreaking medical discoveries in our nation's history. I believe we have found a solution to autism." This announcement marks yet another instance of the administration challenging established scientific consensus regarding widely used medications, including vaccines and abortion drugs. Critics argue that this trend is part of a broader strategy to undermine the scientific community and promote a political agenda. Robert F. Kennedy Jr. has long focused on autism as a critical issue. Shortly after assuming his role, he committed to identifying the causes of autism by September, pointing to various factors such as synthetic food dyes, childhood vaccinations, and the use of painkillers as possible contributors. Interestingly, while the rate of autism diagnoses has surged threefold over the last 20 years, the use of acetaminophen has remained relatively stable during that same period. This raises questions about the validity of linking the two. Moreover, experts widely acknowledge that genetics play a crucial role in determining a child's likelihood of developing autism. The disorder tends to run in families, and if one identical twin is diagnosed with autism, there is a high probability that the other twin will also be on the spectrum. Some smaller studies have hinted at a possible association between fetal exposure to acetaminophen and later diagnoses of autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. However, the most comprehensive study to date, funded by the National Institutes of Health and conducted by a collaboration of U.S. and Swedish researchers, found no significant increase in risk. Even prior to the release of this study in 2024, a U.S. prepared by National Institute of Health District Court had reached a similar conclusion in a product liability case, further questioning the claims being made. In contrast, organizations such as the Society for Maternal Fetal Medicine continue to endorse the use of acetaminophen for managing fever and pain in pregnant women. They argue that failing to treat fever can lead to severe complications, including miscarriage, birth defects, or premature delivery, particularly in the early stages of pregnancy. Additionally, the administration is expected to propose that leucovorin, a form of vitamin B often used to address deficiencies caused by chemotherapy, might be beneficial in preventing or treating autism. This suggestion is based on research indicating that many individuals with autism may have a metabolic issue that limits the amount of folate reaching the brain. Leucovorin could potentially bypass this metabolic barrier. However, while leucovorin interacts with systems critical for brain and nervous system development and is sometimes prescribed off-label for autism, the evidence supporting its effectiveness remains limited. The Autism Science Foundation recently stated that there are 4 studies indicating low folate levels in pregnant women might elevate the risk of autism. However, they cautioned that this area of research is still in its infancy, and further studies are essential before any conclusive statements can be made. But here's where it gets controversial. Are we truly ready to accept these claims without more robust evidence? What do you think about the administration's approach to linking medications with autism? Join the conversation in the comments below.